Azaatse will present.
Okay. So, Azaatse, I apologize if I butcher out your name. It's so Azaatse Terngu Titus is going to present the study on diabetes insipidus predictors after pituitary macroadenoma resection. Please make sure you're audible, Azaatse.
Can I be seen and heard?
Yeah. Yeah, I can see we can see your screen, and it's not being shared on a.
Can you see my document?
Yes.
Can you see it?
Yes.
Can you see my document? Okay, good morning, my teachers, and good morning, colleagues. My name is Azaatse Terngu, and I'm from Memphis Hospital, Enugu, Nigeria. This morning, I'll be making a formal presentation of our paper, which we titled Diabetes
Can you make it in a
Insipidus.
presenter mode, please? Can you make it in a presenter mode?
Okay, thank you, ma'am. Can you see?
Yes, that would be much better. Thank you. Appreciate it.
So I'll be making a formal presentation of our paper, which is titled Diabetes Insipidus Predictors Post-Pituitary Macroadenoma Resection Surgery. As you all know, diabetes insipidus is a commonly reported complication following a pituitary macroadenoma excision, and its incidence has actually been pegged up between 9 to 54%. The added treatment costs that patients incur, together with derangement in fluid and electrolyte imbalance, has actually led to a development of strategies that to prevent and also to predict diabetes insipidus. Surgery-related and tumor-related and demographic parameters have actually been demonstrated to have a varied ability to predict NDI. Our study was a retrospective study that was carried out in Memphis Hospital between 2006 and 2025 on patients that had a resection of pituitary and macroadenoma in Memphis Hospital. And we're able to retrieve perioperative records that were gotten and are included in demographic, endocrine, anatomical, and operative data of this patient. We're also able to retrieve from our PAC system the brain MRI of this patient, and we're able to diagnose NDI using a set of clinical and laboratory criteria. Categorical and continuous variables were actually analyzed using the chi-square and independent t-square respectively. And we were able to predict the I by assessing the parameters using logistic and regression. From our result, we were able to find out that 56.4% of our patients had diabetes insipidus, and this was about 53 patients out of the 94 patients. And we had patients that had deep permanent DI was the least, and it was 11.3%. Majority of our patients had transient DI that constituted about 69.8%. Our total population had a skewed preponderance towards a male. The male to female ratio was 2:1. The average age of those who have diabetes insipidus were 35.3 years, and those that did not have diabetes insipidus were 56.4 years. And there was statistical difference between these two age groups. We're able to also find out that the average age of presentation was 42.9 and 43.2 months, respectively, for those with or without NDI. Radiologic apoplexy was noted to be found in 54.3% of our patients, but this did not have any statistical significance. We're also able to find out that the endocrine parameters did not have statistical significance. However, suprasellar extension recession route were significantly significant in difference in both groups. With the use of a univariate and logistic regression analysis, we were able to predict a younger age group and a suprasellar extension, transcranial approach, and total recession were actually predictable of DI. However, the loss of pituitary bright spot and intracavernous extension were not predictive of DI. Other parameters that were not predictive of DI was patient gender, hyperprolactinemia, hypocortisolemia, and intracavernous and tumor extension. On multivariate analysis, only younger age group were able to predict post-operative NDI. With respect to discussion, we were able to find that our work was similar with the work done by Azaatse et al., in which he also reported younger age group to predominantly predict NDI. However, tumor size and suprasellar extension and pituitary bright spots were not predictive of the eye. Transcranial approach may reflect the impact of traction and vascular injury to pituitary stalk via the growth. In conclusion, postoperative diabetes insipidus in pituitary macroadenoma is predicted by a younger age group of patients and associated with younger age at surgery, suprasellar extension, transcranial approach, and total tumor resection. Thank you.
Thank you.
Thank you.
Yeah, I don't see any questions.